I'm at that point in my life where hormones are starting to change. Things are getting strange. I want to try to explore some options out there to help.
What are some of the solutions that people are finding useful?
I feel completely in the dark.
Maybe medication, maybe something else.
I want to do it more naturally if I can.
There was no information given to me about that.
That there are treatments, both natural and synthetic.
Why is this not being discussed when I'm going to see my gynecologist every year?
That there's actually hope.
I feel like we've done a really good job outlining what's terrible about menopause. But I'd love to get into some treatment options. What is available to us? What can we do?
We always like to sound out our patients for what they feel comfortable with. There are people who love medicines, and there are people who hate medicines, stuff like that. But we fortunately have some good herbal approaches which can be helpful. And then we have another category, which is non-hormonal medications that can help with symptoms. Now they probably won't help with every symptom in the world, but they will help with a lot of symptoms, and they're pretty good. And then we have a lot of options within the hormone realm.
Well, I think every woman should be able to understand what the risks and benefits of our hormone therapy, have that applied individually to them, their family history, their personal history, and have the option of deciding if it's best for them. But many women after 40, they have lower progesterone. So we have a FDA-approved bioidentical progesterone that we can supplement the cycle with. And then when they get to the point where they're lacking the estrogen, we have many FDA-approved bioidentical estrogens to choose from, whether it's a patch or a gel in different doses.
And there are some nice studies out there showing that testosterone administration can be helpful for libido.
So there are a lot of options than there were 20, 30 years ago for us.
Many more options.
And it's a game changer for a lot of people. Now, some people don't do well with it, and that's why we have trial and error with a lot of this as well.
And when do patients usually start those hormones? When they're officially in that year, they've had the 12 months without their period?
I don't wait the 12 months.
Wait.
So a lot of people can be very symptomatic. They can go 7 months and then have a period, then go 4 months. And in those longer periods of time with estrogen deprivation, they're not sleeping every night. They have the brain fog that's affecting their performance, and they're punching their husbands in their sleep and whatever else they're doing.
And the other thing is, somebody who's gone a full year without a period or 2 years without a period and comes in and say, I've had it, it's enough, I need therapy at this point. That's actually pretty easy to treat. Perimenopause is a lot trickier. Now, there are a few other options that we can do in the perimenopause besides just straight hormone replacement therapy. For example, a low-dose birth control pill can be a fabulous option for women in perimenopause. It can be really good for controlling the funky bleeding that people get. And the other thing, we have a lot of people who do have infertility problems, unfortunately. But there's sort of a fertility problem, too, because until you go that magic year without the period, you can still get pregnant. The nice thing about a low-dose birth control pill is that can prevent pregnancy as well as take care of the hormonal fluxes.
I'd love to ask you, Dr. Scott, how have you seen hormones help your patients?
Sleep is amazing. People are so thankful. I had a patient come in last week and said, thank you, I'm sleeping. And she was on the lowest dose patch and the lowest dose progesterone. The things like new onset migraines, and for them to have that relief with hormone therapy, it's a game changer for a lot of people.
And of course, the other thing, which we haven't talked about so much, and I love to say the word vagina, so we're being cut, we're being edited. Anyway, but women, unfortunately, a lot of us will get dry vaginas in menopause because we're not making so much estrogen, and it's really generally a function of how much estrogen is there moisturizing the tissue. And taking vaginal estrogen is really quite safe for really just about everybody. The amount that gets absorbed systemically is so low that the Menopause Society and the American College of OBGYNs have both issued official position statements saying that women who have a history of breast cancer may safely use vaginal estrogen. So that's how little gets absorbed.
We also have FDA-approved DHEA vaginal cream, which I think works amazing.
Works very nicely.
And potentially might be a better option for breast cancer patients or patients who are worried about estrogen exposure.
Lots of options.
Shab and Megan, what has worked for you? What have you tried and what have you found relief with?
So I like to think of myself as a human guinea pig because I'm not afraid. I'm going to try everything and anything. So I've tried the vaginal cream, the testosterone, the progesterone, and I love it all, except I had a little bit of weight gain as a side effect from my hormone therapy, but Otherwise, I loved how it made me feel. The anxiety started to get better, the dryness got better, and the sex drive was like as if I was in my 30s again. It's really been really, really helpful.
That's exciting. Megan?
Once I finally decided to speak up and ask for help, because initially I was like, I'm just going to survive this. Let me change my lifestyle, how I'm eating, let me move more, all the things that you see. I needed more help personally, especially for the mental stability. So hormone replacement therapy was really what gave me the relief, using the nice little patches for the estrogen and the progesterone at night. I got my sleep back in check. I got my joy back. And for me, I was lucky. We found that combo right off. And I know a lot of women that's not the case.
That's great news.
The important thing, though, to take away is we can help just about everybody. Okay, and I think that everybody on this stage is really here because we are committed to that we can help pretty much everybody, and we can make everybody have a pretty good vagina. And the other good thing about it is
a great tagline. We can make everybody have a pretty good vagina.
So the other thing about the vagina, it is a very forgiving organ. So if somebody hasn't had sex, and they haven't had sex for 10 years and stuff like that, but then they really want to get sexually active, we can fix their vaginas, and it's a very powerful feeling. So anyway, we got lots of stuff.
Wow, never thought of the vagina as forgiving. It's so nice to hear. So nice
Forgives
to hear.
but doesn't forget.
It does not forget.